Okay, I've started the timer and here is your question. Okay, so if you've read and understood, considering it history-taking station, please begin.
Hello, my name is Dr. Mahmoud, one of the surgical doctor. Can you please confirm your name and age, please?
I am Smith. I am 43 years old.
Okay, nice to meet you, mister. So today I have been asked to ask some question about your problem. Are you okay with that?
Yeah, for that I came to your clinic.
Okay. So how can I help you today?
Doctor, I am complaining of my both legs become painful when I walk just for 50-meter distance.
Oh, I'm
Since
sorry
6
to hear
months.
that.
Yeah.
Do you have any pain now?
Yeah, I have some.
Do you need some pain medication?
Okay, thank you. I will after that thing.
Okay. Okay. So could you tell me where is the pain exactly?
Exactly in my thigh and also in my legs.
Okay. So when did it start? How long?
6 months.
6 months. Okay. So how did it start? It was sudden or it was gradual?
It's gradual, but last month it is the same.
Okay. So can you describe how was the pain? Is it like sharp pain or dull pain?
It's like something like a tightness in my legs, in both legs. Tightness, tight pain. Yeah.
Okay. So do you feel this pain any other side? Is it
No,
moves
it's
anywhere?
just no, it's just in my legs.
Okay. So is that pain like any specific time of the day, like in the morning or evening, or is continuous?
No, just when I walk or going upstairs, there's a severe pain in my legs. I should sit down 5 minutes, 10 minutes, then I continue my walk.
Okay. So does anything increase the pain?
Yeah, as I said to you, walking is increasing the pain. The rest relieve the pain.
Okay. So does anything feel better, this pain?
No, just the rest make the pain better.
Okay. So when you have some rest, the pain subside?
Yeah, exactly.
Okay. So could you please score the pain? Say 10 is the highest and 0 is the least.
Yeah, 9/10.
9. Oh, I'm
When I
sorry
walk,
to.
yeah. When I walk,
Okay.
it's 9/10. Okay.
Okay. Sorry to hear that. Yes.
Thank you.
Okay. So have you had any trouble with your legs before, or is like only for the 6 months?
Yeah, only for 6 months.
Okay. So how is your health been recently?
How?
How is your health been recently? Are you feeling unwell?
No.
Okay. Do you have any weight loss?
No.
Okay. So when you feel your pain, do you feel cold in your leg?
Yeah, sometimes I feel it's cold.
Okay.
Yeah.
And your pain, does it increase in cold weather?
No, the cold weather, the pain increases. With the cold weather, the pain increase. Yeah.
Okay. So have you noticed any color changes in the skin of your leg?
Yeah, sometimes I feel it's becoming like a blue color.
Okay.
Yeah.
So do you have any ulceration or any tissue loss on your leg?
No, but I feel that my hair on my legs is falling. I don't know why.
Or you are losing some hair from your legs?
Yeah, yeah,
Okay. So do you feel pain after some exercise?
yeah.
And you said is
On
getting
my leg,
better if you
it's it getting rest or sit down.
yes. Okay. So as you mentioned, like the pain is increasing when you go uphill, right?
Yeah, yeah.
Okay. So is it like relieved your pain when you bending forward?
No,
Okay. Do you have any back pain?
no,
Okay. Do you have any like numbness or any tingling sensation
no,
of your leg?
no, no, no,
Okay. So do you have pain on your calf area?
no. In California, no. This is all my legs. The pain is on all my legs.
Okay.
Thigh and leg.
So is there any swelling of your calf area or of your leg?
No, no, no,
No redness?
no,
Okay. Do you have any chest pain or breathing difficulty?
no, no,
Okay. So have you ever been diagnosed with same problem before?
no, no. It's for first
Have you
time.
ever been admitted to the hospital?
No,
Do you take any regular medication?
no,
Have you had any surgery before?
no,
Do you have any allergy? Any drugs or
no,
anything?
no, no, no.
Okay, can
Okay.
you please
Does
summarize your exam history now?
okay. Uh, today I have been examined Mr. X,
Please
43
on the
years,
history. Yes,
is 43 years old male.
yes.
So he's an old smoker. So he came with pain on his lower limb for 6 months, and the pain is increasing when he is walking or when he is going upstairs, and is relieved by rest. And he feels some coldness of his leg, and he noticed that he has some hair loss of the leg, but there
Yes.
is no ulceration or any tissue loss is
Yes.
found. And there is no calf area pain or swelling. So
What are your main provisional and differential
so my
diagnosis?
provisional diagnosis is peripheral vascular disease,
Yes.
could be a Barber's disease due
Yes.
to smoking.
Yes, and differential diagnosis you'll consider.
So could be a DVT or
Yes.
could be maybe a diabetic foot or
Or
what else
spinal
I can say?
claudication, because you
Spinal
did ask
claudication, yes.
if patient's pain increases while bending forward. So you did ask that.
Yeah.
There could be even spinal canal stenosis, or can even be osteoarthritis or musculoskeletal injury. Right.
Okay.
How would you differentiate between vascular claudication and spinal claudication?
Okay, so vascular claudication, the patient might have cold calm periphery, and in spinal maybe warm, and then here it might have some ulceration or skin changes, and there will be no ulceration, and patient might have a history of trauma or maybe back pain, and for vascular claudication, patient might have history of smoking or diabetics.
Okay, more?
Pulsation, maybe for vascular one, patient might have poorly palpable pulse, but for spinal, the pulse will be palpable well.
Okay. The major difference is that for peripheral vascular disease, pain is brought about by exercise and relieved
exercise,
with rest. And relieved with rest.
relieved by
Whereas
rest. Yes.
spinal claudication, pain is often relieved when patient is walking uphill. So that is the major difference. All right. What investigations would you ask for?
Okay, so here The same thing, we can do a full blood count, we can do D-dimer, we can do lipid profile and blood sugar level. And for imaging, we can do arterial duplex, we can do CT angio or MR angiography.
Very good. And what treatment would you suggest this gentleman?
Okay, so for this gentleman, I will ask him to smoke, stop smoking.
Okay.
Then we can ask him to elevate the lower limb while resting or sleeping. Then he can use pneumatic or other compressive stockings. And
Yes.
then we can add some medication, antiplatelets like clopidogrel or low dose of aspirin.
Yes. And last
And
resort, if it doesn't work, patient
if it doesn't work, then we have to think about surgical option.
like endovascular
We
stenting.
Yes, after the Doppler ultrasound, after getting the level of the obstruction, we can ask for like thrombolysis, endovascular stenting, or bypass grafting.
Yes. Last resort amputation. Okay.
Mhm.
Bell is gone, so I'll ask you, if time would have allowed you, how would you have completed your history?
So, if time would allow me, I will ask the patient for his idea and concern and um, expectation. Mm.
Yes. And the
And of course, I
systemic.
will ask for some systemic
Very
disease.
good. Very good. Good. Thank you.
Also, smoking history didn't ask me
Yeah.
about smoking.
Yeah. Smoke.
Yeah, that one I
Social
just
history.
about to
Social,
ask, and then
social and family history was also there.
yes, yes,
And
ma'am.
maybe the medication history.
Yeah, I finished up to the family history, so I just
Yes.
about to ask about the personal history.
Yes. Good. Good. Thank you. Right.